Hey guys, I've been getting a lot of questions on what nose Botox is for. It's fairly an inexpensive treatment, but I want to give you the truth as to how it works and what you should expect after your treatment. The first reason that we like to use Botox for in the nose is probably for the droopy nose. And when I say droopy nose, it's not for people who need a non-surgical rhinoplasty. This is for people who we notice that the depressor muscle, which is the muscle right underneath your nose right here, is very strong and needs to be loosened for the tip to raise up a little bit. When I say that, a lot of these patients actually have this issue. When they're talking, their nasal tip is actually moving with their mouth. So in that situation, when we inject Botox right underneath, anywhere from 4 to 6 units, it really helps to smooth out that muscle, and so just helping it lift, because the depressor muscle is depressing, it's pulling down on your tip. And so once I put the Botox and once that muscle is no longer active, it's just gonna naturally help lift the tip of your nose. The reason why we would do nose Botox is for people who have extra flaring of their nostrils. So as you're smiling, laughing, talking, if you notice that it's flaring a little extra than you'd like, we could actually put a little bit of Botox, more so like on the sides right here, to help decrease the flaring. And probably the third reason why we would do nose Botox is for the bunny lines. The bunny lines are the ones up here. But this is an area where you have to be a little bit conservative when you're treating, because what ends up happening if you freeze that muscle, you're going to notice a lot of your skin and the movement and the wrinkles are kind of going underneath your eye. And I mean, we wouldn't want to do that. So we treated it enough where it decreases the muscle, it decreases the wrinkles and the appearance of the bunny lines, but we don't actually freeze that muscle. The treatment is usually anywhere from 4 to 6 units, maybe a little bit more if we're treating more of your bunny lines. It will last you anywhere from 4 to 5, possibly 6 months, depending on how quick you metabolize Botox. We do use Botox from Allergan and not Dysport. Just depends on how quick you metabolize the product, really. If you guys have any questions, feel free to call us, DM us, or even just come in for a free consult. A lot of times when we want the nasal tip to go up, I like to combine this with the non-surgical rhinoplasty, and you really get a nice lift after the Botox kicks in, which is anywhere from 7 to 10 days.